It's not a perfect system, but it's needed healthcare coverage.
Angela Hopperton of Louisville is invested in the conversation around Medicaid's future.
I don't make a whole lot of money, but I'm lucky enough to make a living doing what I love. So that's important to me.
The program provided her health insurance for 2 years.
I would say, oh, it makes me feel great. I'm not on Medicaid anymore. Why should I care? Except millions of people in this state still are.
Starting in early 2026, Kentucky would see a 10% decrease in funding for a Medicaid model the state uses to pay healthcare providers. That's if the latest version of President Trump's big beautiful bill, including billions of dollars in cuts to Medicaid, passes the finish line. Mark Birdwhistle is the Senior Vice President for Health and Public Policy at UK.
I think this change, if it lives from the Senate, and if the House were to adopt it, it will cause us to reassess everything that we have in our planning horizon.
Shelbyville Hospital, seen here from our Sky 11 drone, generates more than $36 million in operating revenue and has no plans to close, according to a U of L Health spokesperson. But we're told if this mega bill passes as is, hospitals across the state will be forced to consider significant changes in how healthcare services are delivered.
I do fear for lack of access close to home for a lot of people, particularly in rural Kentucky.
Kentucky Senate President Robert Stivers has a different view.
It is not a cut, it's just not as great of an expansion. Did you hear a single university hospital or the KHA complain about the bill? No.